Hi everyone, Dr. Nemechek here. I've had a request by a couple people lately about when do we stop rifaximin in a child? Okay, now um, I want to talk about how I stop rifaximin in an adult first to give you an idea. So if somebody comes, say they're really bad shape, multiple injuries or long COVID or something like that, I'm typically starting people on continuous rifaximin with the other, fish oil and olive oil and a vagostimulator. And we get them to improve, say they're substantially better in 4, 6, 8 months. Okay. But they're on continuous rifaximin twice a day. Then we just stop them, and they coast, and they may go 1 to 6 months before the bacterial overgrowth, SIBO, comes back. And they can almost always tell. Their anxiety gets worse, lightheadedness, or the rash, or they get some intestinal tract symptoms. They can almost always tell. And then we just treat them for 10 days. So they might just one to a couple times a year do just 10 days of rifaximin to reset their gut. Now they're continuing on the fish oil and olive oil and stuff. But that's how we do it in adults. Now, but the thing is, the adults can help me to figure out what to do. So here we have we're just going to say a severely developmentally delayed child or autistic child, really challenged. Put them on the protocol. They're starting to improve and recover. One, I don't plan on stopping continuous rifaximin in a kid till they're dang near normal. Okay, even if that's a couple years. And because we're talking about brain recovery here. Okay, so if we've got this good response, we just keep going. Now let's say we're at this point where we're like pretty close to being neurotypical. We're seeing this. We have a new kid like this about every week now, where they've lost their diagnoses, there's no more therapy, blah blah blah. There might be some tiny little things that just alone aren't really noticeable to anybody else. And the parents are saying, okay, what do we do? Well, most of these kids aren't mature enough. If you stop rifaximin, I'm not saying don't, but if you do what I kind of do with the adults, you stop the rifaximin, it's really hard to tell when they need it again. And, what you might notice is the focus is bad and they suddenly are failing in school. Okay? It's not, and the kids just don't have the maturity or ability to decode kind of what they're feeling and report that to the parents and, as these adults can for themselves. And so to be able to do that like an adult, we need a pretty mature kid, mid-late teens. And boys are worse at this than girls. And so it's hard to know. But the rifaximin is so safe. Doesn't damage your biome, doesn't get in your bloodstream. Hell, it's safer than these antihistamines, cold medicine, pretty much any over-the-counter medicine at CVS. And so, I kind of think of this as like, if it's my grandchild, what would I do? I'd probably keep them on the rifaximin and not have them relapse at all until they are mature enough to do that. And you might test it out in the summertime when they aren't in school. So if they fail to tell you something and they start relapsing, their focus starts getting worse or something like that, you can get them back on it and not disrupt part of the school year. So it's a difficult question, but that's kind of one we're going to have to work together on here in the future. But I certainly wouldn't go to intermittent rifaximin when we still got a long way to go on recovery. I wouldn't do that at all. Okay? I would just stay with continuous, even for, I don't care how many years. As long as they keep recovering, we're trying to get enough neurological recovery so this child can be self-sufficient as an adult. And that's the name of the game in my book. You know, I mean, I certainly want them healthy and happy, but that's part of that. All right, I'll quit talking. Everybody, have a good day. Hope that was helpful. Bye.